Welcome, class, to Chapter 15 on eating disorders. Today we are going to discuss some of the most commonly diagnosed eating disorders. So let's just think about some of this stuff. Eating disorders obviously have to do with food, but they also have to do with body image and emotions and psychological status. And so what is ideal body image and how does one achieve it? Unfortunately, I feel that TV, media, advertisements, magazines, especially social media, often portray an ideal body image that may not be very healthy and just really isn't achievable for the average person. This can make people feel inadequate about their own body image and potentially lead to eating disorders. Why do people diet? There are probably hundreds and hundreds of reasons for diets. Many people will diet because they want to be healthier, but many people will diet because they want to look a different way. They want to lose weight or fit in their wedding dress or fit in their bikini. Food is a tricky addiction because it is more than nutrition. Unlike other addictions such as alcohol or smoking or drugs, we cannot eliminate food from our world. We need food to survive. Plus, food is many emotional things as well as just a nutrient. When we are babies, we associate food with comfort, our mother's warm breast or our mother holding a bottle for us. We also associate that with pleasure, with calming. And some of our associations with food develop very early in life. That being said, some of our ideals about food can actually be skewed very early in life as well. So maybe some of you were in the Clean Plate Club. What the Clean Plate Club is when you would sit down to dinner with your family and they would say, clean your plate, be in the Clean Plate Club, can't have dessert unless you're in the Clean Plate Club. And no matter how hungry you were or what was served on that plate, you would sit there and eat it all because you were motivated to be in this Clean Plate Club. One, because that was cool when you were 5 or 6 years old, and two, because that increased the likelihood that you were going to get food as a reward in the form of dessert. Unfortunately, using food as a reward is a strategy that is very inefficient and can lead to some of these eating behaviors, eating disorder type behaviors. Many of us turn to food when we are stressed out, when we're worried. Some of us turn to food when we're happy or excited. And this is also our mind overpowering our body's drive for hunger and appetite, and our mind saying, no, I want to eat because this is going to taste good, or I want to eat because this is going to make me feel better, and I'm sad right now, or I deserve to eat because I just experienced a really hard thing. So I did mention a little bit how some of these eating disorders can start, but they usually start small. Most people don't wake up in the morning and decide, oh, I think I'm going to be an anorexic, or I think I'm going to start a career in bulimia. That's not how this happens. But often people do wake up in the morning and maybe they have some negative thoughts and they think, oh man, I really ate too much last night, or my pants just aren't fitting right this morning, or I wish I could wear this shirt. It's just a little too tight now. And so they think, how can they fix that? And often they turn to diets. This sometimes can snowball and build up and eventually end to an eating disorder if somebody lets this get out of control. People who suffer from eating disorders do have a wide range of complications, and you can actually die from an eating disorder. So identifying them is very important. Eating disorders are not, like I said, it's not that somebody wakes up in the morning and decides that they want to have an eating disorder. These are true diseases, and they need medical treatment. Types of eating disorders. So there's a Diagnostic and Statistical Manual of Mental Disorders, and in that manual, eating disorders are classified. There are three main types of eating disorders that fall in this manual. However, there are potentially many other types of unrecognized eating disorders, meaning they're not in this manual, but they do exist. So the three main types which we will discuss today are anorexia nervosa, bulimia nervosa, and binge eating disorder. We will also discuss orthorexia, purging, night eating, and very briefly pica or pica. Pica is eating of non-food things, which we have mentioned before. So first, let's start with anorexia. How is anorexia diagnosed? Anorexia is considered a denial of appetite, and people who are anorexics severely restrict their energy intake, meaning their calorie intake during the day. Their calories will be so low that they will usually lose weight and they may be at risk for many nutrient deficiencies. They are absolutely obsessed with their body weight and shape, and the desire to be thin kind of rules every decision that they make in their life. Even if they are thin and think they are thin, sometimes there is a certain area on their body that bothers them, such as potentially their hips or their thighs or their kind of the area under your arm muscle that sometimes can get loose or droopy. And so they have serious issues recognizing their bodies as beautiful and then nourishing their bodies to be healthy. Bulimia is slightly different. Bulimia will revolve around binge eating, and binge eating happens when you are eating an excessive amount of food. This could be in a very short time. The amount of food would be larger than other people would eat, and you feel a lack of control while you're eating this food. So you don't feel that you can stop eating it. For example, you've ordered a whole pizza, you eat the entire pizza within an hour. After that first piece of pizza, you cannot stop. You can't just close the box, put it in the fridge, set it aside. You have to finish it until it's gone. And some of the thinking is that bulimics do have a slight fear of food. And so when they see these foods that they like, it's kind of a love-hate relationship. They want to eat the food, but they also want to get rid of the food because the food is dangerous. And so they eat it all and then it's gone and they've gotten rid of the problem, but that doesn't really work out. Diagnostic tools for binge eating disorder. So the episodes must be associated with 3 or more of the following. So eating more rapidly than usual, like I said, very quickly, eating until uncomfortably full, eating large amounts even if you're not hungry, eating alone. Many of these people will eat in a dorm room alone, will even eat in the closet or the bathroom, will eat in their own cars, will eat in the garage. They do not feel good about this disorder. They recognize it is not normal. They feel very guilty about it. They have distress about it. And this must occur at least once a week for 3 months. Genetic factors. So how do we get these eating disorders? A lot of them, I believe, stem from societal pressures, potentially emotional imbalance, psychological factors, stress, everything, but there is a role that genetics plays. They have done studies on twins, and even twins who were raised in different households, they have similar probabilities of sharing eating disorder than just non-related people of the same age. So that is very true. Even they have a higher rate of eating disorders or similarities compared to non-twin siblings. They think there are many genes that are involved in this process, and some of the genes may affect the actual development of the eating disorder. Some may affect hormones, some may affect neurotransmitters, some may affect the satiety response, some may affect mood, depression, all sorts of different things. There are commonly other psychological issues that are seen in combination with eating disorders, and sometimes these can become worse due to the eating disorders. Who is affected? So, generally speaking, women, middle class, Caucasian, are more likely to suffer eating disorders than other populations. However, everybody can be affected by eating disorders. In this little informatic I have here, you can see 1 million men are affected, 80% of all 10-year-olds are afraid of being fat, and 42% of first through third grade girls want to be thinner. I just think that that is heartbreaking. Where do we get these ideals for what size we should be? The average American woman is 5'4", 140 pounds. The average female model is 5'11", 110 pounds. So yeah, our bodies do not match these ideals that we portray as representing perfection. All right, some of the physical effects of an eating disorder. So some of these overlap and some of these may be different depending on the eating disorder. Bulimia, you can have irritation of your esophagus and teeth. Binge eating disorder, you see this man at the bottom has gained weight. He also is at risk for chronic diseases. Anorexia nervosa, bruising, low body temperature, low bone mass. And then shared between the three of them are sleep disturbances and immune dysfunction and infertility. Okay, so a little focus on anorexia. Anorexia involves weight loss and distorted body image. Often anorexics have BMIs far below what is considered normal, and they're very deep into the underweight category. It's not that they don't have an appetite, they just tell themselves that they're not hungry. They kind of trick themselves almost. I'm not hungry, I'm not hungry, I'm not hungry. And they deny themselves the chance to eat. They are legitimately afraid of gaining weight. This is a very irrational fear. And even though they have this irrational fear, they actually think that they are totally correct and sane and rational, and that everybody else is being irrational. This affects about 0.8% of American women. Behaviors. So like I said, some of these things start very simply. This could start with just a desire to lose weight. You know, maybe somebody has said something to you, or you have an event coming up. You know, maybe a comment from a friend. Maybe you had to fit into a uniform for a sport event or for work. And sometimes people think that changing their appearance can help them, you know, kind of reinvent themselves and be successful in new situations. So sometimes that could be part of it. The only thing that anorexics feel that they can control is food. And sometimes this is true, sometimes it's not. Common things that they might do during a meal: they might spread the food out on the plate, so perhaps it looks like they ate more of it. They may cut the food into very small portions. I've seen people rip food such as bread or fruits, even meats I've seen people rip. They will weigh themselves frequently before and after meals. And they might say they are full or that they have already eaten, especially in a social situation. Other things that they may do: they will have extreme diets. They may only eat safe foods. For example, there have been anorexics who would only eat grapes and water. There have been anorexics who would only chew sugar-free gum and eat Cheerios. You know, they might have foods that are considered safe to them. Other foods they avoid because they're afraid those foods are associated with weight gain, and or those foods are more likely to be addictive and they could lose control over them. They may be very moody and hostile. This can be because they feel very insecure about their bodies and they're undernourished. I mean, talk about hangry. These poor people are very undernourished as well as, you know, insecure, and that's just a horrible combination. They might withdraw from family and friends, especially around meal times. They often avoid eating out. They sometimes feel that they're excessively criticized. Sometimes they do poorly in school. This is associated with depression, hopelessness, just so many sad feelings. Often diets of anorexics, like I said, they're very calorie deficient, and sometimes they're only getting about 300 to 600 calories per day. They may try to fill up, and fill up is in quotes, air quotes, on foods that would be considered free foods, so sugar-free gum, diet sodas, water, sugar-free iced tea, sugar-free candies, things like that. Physical consequences. So our body cannot keep up with anorexia. We suffer tremendously. One of the things that happens is lower body temperature, and this is because our fat layer is an insulating and protecting layer. And when you have anorexia, your body weight drops, you lose that body fat that helps insulate you. Iron deficiency anemia can develop from poor intakes. Rough, dry skin and bruising can develop due to vitamin deficiencies, protein deficiencies, as well as loss of that protective fat layer under the skin. Loss of hair, usually due to vitamin and calorie deficiencies. Loss of menstrual periods due to reduced hormone production because of inadequate intakes. Muscle tears, low bone mass due to inadequate calcium, low vitamin D, low weight-bearing exercise, and sleep disturbances or depression. So just so many negative things that can happen. What happens to people with anorexia nervosa? So most do recover within 6 years, and this could be with treatment or on their own. 3% die from the disease. So as far as eating disorders go, this one has some of the highest rates of mortality. Why do they die? They die because they get too thin. And when they get too thin, their immune system cannot function properly. Their heart cannot function properly. And often this is associated with psychological illness. So some unfortunately do die from suicide. The physical damage can last a lifetime, especially for structures like the bones, which when you are young, that is when you're achieving your peak bone mass. And if you miss that opportunity, you never get that opportunity again. Anorexia is a serious disease, so these people do need comprehensive and immediate treatment. This is a movie I'll add to our website, and it's about Isabelle. Isabelle was a French model, and she actually became a speaker to raise awareness for anorexia because she herself was anorexic. At her lowest point, she was hospitalized because she was 5'4" and only 55 pounds. She began to gain back weight. However, the damage done to her body was just too much to bear. And at the weight of 80 pounds after filming this documentary, she unfortunately passed away due to complications. So she was making a recovery, but unfortunately it was too little too late. So very, very sad. Okay, so I know we're online now. You don't have a piece of paper. I'm not going to turn this in, but this is just kind of questions for thought. And I don't think there's a wrong or right answer to this. There might not even be one answer to this. This might be kind of a spectrum of answers. But which is a worse disease, anorexia or obesity and food addiction? It's something for you to think about. All right, treatments. So how can people like Isabelle get treatment? They can go to eating disorder clinics. These would usually be daytime clinics where you might see a specialist a couple hours a day. You can do outpatient therapy. This might be 3 to 5 days a week where you are going to go during the day to a clinic, and the clinic is going to have multiple professionals, registered dietitian, social worker, psychologist, doctor, nurse, things like that. You could go to a day hospital. This might be 6 to 12 days of daytime hospitalization, however you'd go home at night. Or if you have dropped your weight below 75% of normal, you would actually need to be comprehensively hospitalized. And in this case, you would be trying to get renourished by the hospital team in the way that you could. The way that they would do that would be by administering IVs, giving you IV vitamins and minerals, IV fluid rehydration, and potentially tube feeding, as well as extensive counseling on diet and psychological issues. Nutrition therapy. So what is important for a nutrition therapist to consider? Obviously, this is going to take time and this is going to take trust. These people do not trust their own bodies. They're not comfortable with their own bodies. And so they really need to go out on a limb to become comfortable with somebody else telling them now what to eat, because that is giving up a lot of control. The first initial goal would be to reduce continued weight loss, meaning just halt it where it is. And then once the person becomes more stable, you can work on weight gain. Certain vitamins and minerals are commonly deficient, and so replacing those or making sure there's a diet adequate in those is very important as well. Psychological therapy, obviously these eating disorders are usually not even really about the food. And so a psychological investigation and treatment does need to happen. What is the emotional problem leading to this food issue? Is there a family problem? Has there been abuse, sexual, domestic, verbal, physical, is there poverty? What is happening here? In the case of young adults, they have found that family therapy seems to be very beneficial. And if the whole family can be involved in therapy, they usually recommend 6 to 12 weeks. It is more productive than if the individual attends alone. Okay, what about medications? So since there is often a link between psychological disorders, even very common ones such as depression and eating disorders, sometimes treating those psychological disorders can help. Prozac is a drug that is commonly used as a adjunct to eating disorder therapy, and sometimes this can be effective. Bulimia. So, bulimia, could almost say it's the opposite of anorexia. Bulimia is this ox-like hunger. That's how the word directly translates to. And so, bulimics will eat excessive amounts of foods in short amounts of times. They'll feel uncontrolled while they're doing this. They kind of have this momentary insatiable hunger, and then they feel extreme guilt that they have done this. A lot of people can hide this, and one of the reasons that they can hide this is because they may not look different than anybody else. Anorexics do look different. They often look thin, pale, fragile, even skeletal. Bulimics are not generally underweight, and in fact, many bulimics may even be overweight, and we'll kind of explore why. So what do? They think of food constantly. They turn to it when they're stressed. They do realize that what they're doing is not normal and not healthy. However, they can't control it. They have this thought. They are really, to me, they're food addicts. I'm not a psychologist, but to me, they're food addicts because addicts think in this same way. 1 is too many, 10 is not enough. Meaning, 1 hit is too many, 10 is not enough. And that the concept of this is kind of once you start, you can't stop. A lot of bulimics will do this with whatever food they're eating, a tube of cookies. Open that package of Keebler cookies. A bulimic person could not probably even have that package in their house, but they could not just open it and have 1 or 2 cookies. Once they had those 1 or 2 cookies, they usually end up feeling this just kind of raging guilt. And for whatever reason, the way to cure that raging guilt is by continuing to eat these cookies. And so they will finish the entire tube of cookies. They'll still feel guilty about it. And in some cases, they do purge. So, yes. How do they purge? So they will binge. The binge is eating this excessive amount of food, more than somebody would normally eat in a short amount of time, often in private, and then they purge. They purge by vomiting. Vomiting can be self-induced. They purge by exercising, meaning they will go to the gym and work out for 4 hours straight after they've eaten this big meal. They feel guilty. They may use laxatives. They may use things that can make them vomit, such as syrup of ipecac. And this can lead to all sorts of really kind of debilitating behaviors. Because they have to have this big amount of food to satisfy their need, not their need, but their addiction to this. Sometimes they have to shoplift to obtain the food. And sometimes people have even stopped paying regular bills like phone bill, electricity bill, water bill, etc., because they're spending all their money on food, which is then purged. Does purging even work? So this is a picture of a woman over a toilet, obviously. And I don't mean work. I mean, does it work in the way that a bulimic thinks it works? A bulimic thinks that purging works to get rid of all of those calories that they have just uncontrollably eaten. The thing is, it does not work. When you vomit after eating an excessive amount of calories, you only get rid of about 33 to 75% of those calories. And so what that means, you continue to absorb that much. So you get rid of much less. And so what that means is if you're eating these excessive amounts, whole bags of cookies or whole, containers of ice cream or whole pizzas or whole chocolate bars, you will gain weight. Laxatives, people commonly take laxatives. Laxatives work in the large intestine mostly. By the time our food gets to the large intestine, we have absorbed 95% of it, and we have already used those calories. Exercise. Exercise will help burn calories. However, the amount of exercise needed to compensate for these typical binging experiences is just an unrealistic amount that anybody could possibly do in a day. Physical effects. So because of all the vomiting, you can have dental issues, primarily decay and cavities. This is because when you vomit, stomach acid comes up, and that kind of breaks down the enamel. Also, people are commonly nutrient deficient, and that can lead to dental issues as well. Low fluoride, low calcium, low blood potassium. As you vomit, you lose potassium. Also, if you are vomiting and not eating healthy foods, you're not going to be getting enough potassium. This can actually lead to heart arrhythmias, muscle cramping, etc. Swelling of the salivary glands, stomach ulcers, constipation can happen. If somebody abuses laxatives for a long period of time, their body actually kind of becomes immune to them. Their body doesn't know how to, create peristalsis and move food by itself. It's relying on these laxatives. The mortality rate from bulimia is much lower than the mortality rate from anorexia. However, it still is significant. Treatment. So what is the treatment? It would be similar to anorexia, meaning there could be a day stay program, an outpatient center, a hospitalization. It would involve multiple disciplines, so dietitian, doctor, nurse, social worker, psychologist, psychiatrist, even the family potentially. 16 weeks would be ideal, if not more. And you want to just try to reestablish regular eating. So normal size meals, normal times, in public, with friends, regular bites, normal pace, just kind of going back to the basics. Foods that somebody is likely to binge on should be avoided. And people may binge on any sorts of different things, but often people will binge on foods that are rich in carbohydrates and easy to throw up, because certain foods are more difficult to throw up than others. Certain foods are more difficult to, or more irritating to throw up than others. For example, very spicy foods. So they generally eat sweet, kind of soft foods. You don't want them to weigh daily because that could lead to kind of some self-doubt, and you want to set time goals. So putting the fork down in between bites, etc. Additional treatment. So what is the underlying issue? How can we fix it? How can we get this person back in control? Again, some of these pharmacological treatments do work for this disorder. What else? Also, counseling can help. Reassuring the patient that, in this example, eating one cookie is not failing. And I think this is very important because often these people feel that if they slip, they might as well give up and just stop everything that they've already done and go back to being bulimic. But it's not. Most bulimics will have relapses. relapses on a regular basis. The longer they have kind of been in remission from their bulimia, the less likely and the less often these relapses will occur, but they do happen and they are normal and they are part of recovery. And if you help a bulimic understand that, it can help them kind of, potentially they had one bad day, but they wake up the next day and that's a new opportunity and they can continue healthy habits the next day instead of reverting into all unhealthy ones. Binge eating disorder. So binge eating disorder is similar to bulimia. However, there is no compensation. So there's no excessive exercise, there's no vomiting, there's no taking laxatives. You are just eating, and eating way too much, way too fast, even when you're not hungry, kind of an uncontrolled situation. This was described in 1994, however, officially recognized in 2013. I don't know how this was only described in 1994. I believe many people are guilty of this long before the 1994. I mean, just think of Thanksgiving, Super Bowl, Christmas, things like that. These big holiday occasions where we feast and we don't go throw up afterwards. And, we probably eat 3 times as many calories as we should. So I don't think that this is unique or new. The events that I'm describing only happen a few times a year. And so one thing that is different with binge eating is it does have to happen on a regular basis. So at least once a week for 3 months. This is not more common in males, but more common than the other eating disorders in males. So, and again, this is probably largely undocumented because many people will not go seek help for this. And this may be looked at as just, somebody is eating more. I described some of the characteristics already. Again, you're probably not surprised to see this is associated with depression, as are all the other eating disorders. It can be brought on by stress. Often people will isolate themselves. They'll eat in their cars. They'll eat alone. They won't go out. They'll have food delivered. That is a very, very common one. And they perceive themselves as more hungry than others. So this is kind of an interesting one. Physical effects of this. So people who binge eat, most of them do become obese. And because they become obese, they suffer many of the chronic diseases that are associated with obesity. So high blood pressure, high cholesterol, cardiovascular disease, diabetes. And part of the reason for this is the foods that people typically binge eat are not healthy foods. These are high fat, high sugar, high carb, high calorie foods. High sodium foods in addition to that. People aren't like binge eating on kale or binge eating, mangoes or binge eating quinoa. Maybe, but generally no. They're binge eating pizza and chips and ice cream and donuts and cookies and cakes and soda. Yummy, salty, fatty, high calorie, sugary things. Treatment. So let's look at the psychological issues. Why are we doing this? And then look at how we can treat this. So what psychological issues are happening and how can we deal with it? There are self-help groups. There is Overeaters Anonymous. This is an organization that is actually based on similar principles to Alcoholics Anonymous, and people can go and discuss their relationship with food and how they've struggled and then get support from others in a similar situation. There are pharmacological agents that can help, specifically antidepressants, as we've seen before, and then obviously nutrition therapy, which would not just be a registered dietitian, but potentially a nurse, a doctor, a psychologist, a psychiatrist, an entire care team. So, other eating disorders. So now we are going to talk about other eating disorders that are not in this handbook or manual of mental illnesses, but are still very likely eating disorders. So they can't be officially diagnosed according to this manual as a mental illness, but they are recognized as being significant eating disorders. So some of them, purging disorder. So this is purging without even eating. So purging without binging. You just go throw up, or you've eaten a small regular meal, you just go throw it up. This is decently common. Night eating, so eating your food at night. So after you've already had dinner, you still feel like you need to eat. You feel like you can't sleep without eating. You wake up in the middle of the night, you go to the refrigerator, you eat food, you go back to sleep, you wake up again, you go to the refrigerator. And for people with night eating syndrome, often a sleep therapist can help kind of rewire their circadian clock so that they can sleep better at night. And eating and sleep actually play a very, very huge role. So if you're interested in that, I encourage you to look up mycircadianclock.com, or potentially it's .org. But anyways, you can learn about the relationship between eating during hours of the daylight and sleep. Female Athlete Triad. So we've learned about this in one of our other chapters, but the Female Athlete Triad often occurs in competitive female athletes who need to maintain a certain body weight or body shape, or both. And because of this, sometimes they caloric restrict, they protein restrict, they end up with low percentages of body fat, which causes them to lack their menstrual periods, and they end up with osteoporosis later down the road because they are not getting enough calcium, calories, protein, and potentially vitamin D. Muscle dysmorphia. So this is not an official eating disorder, but does occur. And typically it occurs with bodybuilders, often competitive bodybuilders or competitive figure models. You could call it the reverse anorexia because these people are afraid that they are too thin and they actually want to bulk up. Here it says men feel too thin, but it could be men or women. A woman who wanted to be more muscular could suffer from this as well. They become obsessed with food. They're often measuring their calories, measuring their protein grams, logging all their food, logging their exercise, taking body fat measurements, taking, muscle measurements, and working out excessively. Diabulimia. So this is a very, very dangerous eating disorder, and this will occur in diabetics who use insulin, primarily type 1 diabetics I've seen this in, although it could occur in type 2 who is using insulin. Remember that insulin is a key that kind of unlocks our cell's door so that glucose can get in. If you do not have insulin, glucose cannot get in. If glucose is circulating and the levels are very high, glucose will spill out via the urine because it has to go somewhere. And when we lose glucose, we do not get the calories from glucose. So by denying themselves insulin, people who are diabulimic actually can lose weight. There is a flip side to this. Some of them will overeat and then give extra insulin. So some of them are doing more of a compensation type of thing. I have seen a 15-year-old girl hospitalized for her 4th time in the ICU, intensive care unit, came in a coma because of this condition. And she was beautiful, perfect, healthy weight, and she felt awful. She felt that she was fat and ugly and nobody liked her. And this was her way to compensate. And it was so sad. Okay, so preventing eating disorders. These are some things that we can talk about within families, within support groups, within classrooms, within peer groups to kind of reduce eating disorders. And I think that this can start very young. Our parents are our best role models for nutrition and healthy body image. And they've done much research that says parents who talk negatively about their own body shape or weight or discuss going on diets have children who will be more likely to feel negatively about their own body size or weight and feel that they need to restrict food no matter what the child's BMI actually is. So children are like little sponges that absorb everything, and they want to be like their parents. So start young. Eat when you're hungry. Don't eat when you're not hungry. If your child says that they are not hungry, don't make them eat. You say you don't have to eat that. Okay. Let your child tell you when they will eat. I am a mom, so I know that's not always practical, but do the best that you can. If your child says they're full, they're full. If your child says that they're hungry, they're hungry. Encourage good body image, but also talk about qualities of a child that aren't related to body image. So for example, wow, that's a really nice picture you drew, or I really liked it when you shared with that other child. That was very nice of you. You know, instead of praising them for, wow, you look really nice in that shirt, or wow, your hair looks good today. Praise their characteristics versus their size and appearance. In your own words. So if you want to read about some personal experiences in your book, you can. And in conclusion, what are the 3 official types of eating disorders? Characteristics of each, how can we prevent them? And then what are some unofficial eating disorders? Okay, I hope you enjoyed this lecture. This is a very serious topic. If you would like to talk to me more about it, feel free to contact me. And I hope you learned something that you can share with your friends, family, or fellow students. Thanks.